Hello, everyone. Thanks so much for joining us. I'm really excited to talk to our next guest, Allison, who is a nurse anesthetist in New York City, the epicenter of where coronavirus really is. Thank you so much for joining us, Allison.
Thank you. Thanks for having me.
Absolutely. And I know that you guys are working so hard, so I really appreciate your time. Tell me a little bit about your experience and really how busy it's gotten in the hospitals.
It's extremely busy. Basically, everything went from just a normal, regular day, which is busy for our hospital, to just a very challenging environment. We're not sure what to expect. Everything changes by the minute, and we're just adapting the best we can.
Yeah. So tell me, what does your day look like? Or I guess, how is it different from how it used to be?
So basically, most of the elective cases were canceled. So we are working as part of a code team where we respond to airway emergencies on the floor and all over the hospital to just take care of the patient's airway, make sure they're safe, they're hooked up to a ventilator. So some of us are doing that. Some of us are doing emergency cases because people are still sick from other things and they're still coming in. So basically, we're just fighting fires just to make sure everyone is safe.
Yeah. And you're actually intubating people, right? So what does that kind of look like?
So we, a CRNA, a nurse anesthetist, intubates patients. We provide safe anesthesia care on a daily basis, but now we're working as a team with a physician anesthesiologist where we respond to these codes, two of us, or more if we need backup help. And we secure the airway, connect to the ventilator. We kind of turn over to the medicine team that's taking care of the patient.
Mm. And I know when we were talking before, you said that kind of everyone in your location is now a COVID-19 patient.
Yes, almost every
Wow.
patient is COVID positive, including the mothers coming in to give birth. So
Oh,
it's
wow.
very challenging for everyone involved. The hospital's on lockdown, no visitors are allowed. People are dying without their family members there. Um,
Wow.
it's very sad. I can't imagine going to the hospital, being alone, and passing away with none of my family members being there.
No, absolutely not. And you're a nurse like there on the front line. I mean, what's it like seeing all of this and how can people support you?
People can support us by staying home, social distancing, not having big gatherings, practicing hand washing. That's basically it. Just stay home and let us flatten the curve and provide care to the people who need it.
Yeah. I was speaking with some coworkers last week and we were thinking about, writing just thank you letters. And then we were doing some more research online and talking to people and they were like, nurses don't have time right now to open letters, to read letters. And everyone's worried about, germs and well, not germs, but COVID being passed along.
Yeah,
And, just send a text or do something on social media or something like that and stay home, like you were saying.
exactly. My friends have reached out. They said they're thinking of me, they're proud of me. But the best thing is just to stay home and just let us take care of the patients who need our help.
Yeah. On a more local level, there at the hospital, how have things changed for you from day to day? How's the mentality or the culture there changed? Tell us a little bit about that.
Sure, everything has changed. A lot of people are tense. We are not sure what to expect. Things are changing by the minute. Like I said, our hospital has increased to over greater than 50% capacity. It used to be a welcoming institution. When you walk in, you have smiling faces, and now the lobby is converted into caring for patients. Every aspect of the hospital is used for patient care. Other healthcare personnel are being repurposed for different jobs. They're doing things that weren't in their role, but everyone's just trying to help each other. Everyone's doing a great job, but it's tense.
Yeah. What about the camaraderie? The being there with other nurses, with other doctors, with other staff, at the end of the day, are you guys like supporting each other? Is it nice to have someone in there with you working through that?
Despite the craziness, the morale is up. Everyone's working together to just help the patients that need us.
Yeah,
The FDNY
absolutely.
came the other day. They applauded us for coming in and leaving work. So that was like very nice to see.
Yeah, absolutely. I'm sure, getting that feeling of appreciation is nice when you guys are working so hard. I mean, are you guys working extended hours right now?
We're on rotating shifts, at least from the
Okay.
anesthesia standpoint, which is nice because working on these code teams is very challenging. It's mentally fatiguing. So it's nice to have a day off after you work on that team because you're wearing gear, you're walking all throughout the hospital, you're going up flights of stairs, and it's actually our suit that we wear is very difficult to breathe while we're trying to intubate these patients. So it's challenging on physical and mental aspects.
Absolutely. And you need that time to rest so you can come back and still, help save lives. So tell me about, you're talking about your gear. Tell me what all you have to wear. Is there like mask, headgear? Tell us about that.
Yeah, so we have the N95 mask. We wear another surgical mask to cover that. We have a hood that we wear with a clear viewing area. We have a surgical gown. We wear a bunny suit under that. We have surgical booties. We have 2 sets of gloves. Everything that we believe that we need to stay protected, because if we get sick, we can't help other patients.
Absolutely. And that threat is very real. I know for you guys out working there, I mean, are a lot of people worried that they're going to bring it home to their family members?
Yes, we're all worried. We don't want to get sick. We don't want to get other people sick. It's very challenging, especially taking off the equipment, because you have to make sure not to contaminate yourself while you're degowning.
Yeah, I'm sure. Well, what about to other nurses? Do you have any advice for them or words of wisdom or anything you really want them to hear from this?
Just stay with it. Try to be positive. Do the best you can, and do what we were taught in school. Follow the guidelines. Don't try to cut corners, even though you probably want to, and it's probably easier. But just try to stay positive, and you'll get through it.
That's great. I love that. Anything else you really want people to hear or take away from this video?
Just social distancing. Please stay home. Take this seriously. Last month it was China. Last week it was Italy. This week it's New York, and tomorrow it could be you.
Could be Dallas, Texas.
It could be.
Anywhere. Yeah, absolutely.
Yes.
Yeah. Allison, thank you so much for joining us. I really appreciate it.
Thank you so much.
All right. Well, thank you everyone so much for watching. And of course, we have more episodes. Make sure to stay with us, check back in on social media, and we'll keep you posted.